Good morning, brothers and sisters, and welcome to our study today, Sabbath, the 26th of July, 2025, where we are looking at a subject entitled Pregnancy and Midwifery. And so before we go into our study, we are going to have a prayer thought coming to us from the book Counsels for the Church, page 365, and I'll read from starting from paragraph 2. The subtitle says, Skillful midwives needed. Skillful midwives needed. And I read, starting from paragraph 1, it says, it is not in harmony with the instructions given at Sinai that gentlemen, physicians, should do the work of midwives. The Bible speaks of women at childbirth being attended by women, and thus it ought always to be. Women should be educated and trained to act skillfully as midwives and physicians to their sex. It is just as important that a line of study be given to educate women to deal with women's diseases as it is that there should be gentlemen thoroughly trained to act as physicians and surgeons. And the wages of the woman should be proportionate to her services. She should be as much appreciated in her work as the gentleman physician is appreciated in his work. Let us educate ladies to become intelligent in the work of treating the diseases of their sex. They will sometimes need the counsel and assistance of experienced gentlemen physicians. When brought into trying places, let all be led by supreme wisdom. Let all bear in mind that they need and may have the wisdom of the great physician in their work. We ought to have a school where women can be educated by women physicians to do the best possible work in treating the diseases of women. We end here. So with that prayer thought, beloved, we see that God is telling us that the work of childbearing or midwifery should always be left to the women, and that the women should be well trained so that they should be able not only to do the works of midwifery, but also they should be educated in treating the diseases of fellow women. With that, we shall kneel down as we seek the Lord in prayer. You can pray.
Our Father, which art in heaven, you are reminding us time and again, even today, you've reminded us saying that women are the ones to take charge of women. That in simplicity, it means so. So it is up to us, O Master Redeemer, through the power that works in us to do right. May you give us that power, O Lord, to do right, to amend our ways, because we are living in the time of less reformation, but a lot of revival. Yes, revival is everywhere, O Lord, but us to do it is what the problem is. We are not doing. May you give us the desire to do. May you give us the active Christian virtues, O Lord, which requires us to develop. In the name of Jesus, we do pray with thanksgiving in our hearts. Amen.
Amen.
Amen. Okay. So we're together. We ended last time on the birth cow. I don't know if you pronounce it cow or cow. So the birth cow is a sack. The sack that the baby, we call it what? The birth cow. The sack which their unborn child is in. This one, I think this is a. I don't know if you're able to see the picture here. This child was born with a birth. This is a cow. Hello, Sister Chimuka, are you able to see this? Hello?
Yes, I am.
Okay. Yeah. So basically, this is the cow. So there are children who are born with this. There are children who are born with this. Examples of children that were born, they say that Jesus also was born with this one because they say there's a spiritual significance with children that are born with this one. They tend to be very genius and they are connected to spiritual, they have a high spiritual level. So they say, like examples here, examples of the people that were born, famous people born with a cow. That is, say, I don't know if you call it Suleiman. Okay, Shalman, Napoleon, then Libres, Lord Brown, Lord Byron, then Sigmund Freud. I think we know of this man, Sigmund Freud. Okay, in psychology, Sigmund Freud is very known in all the people, the psychology that we learn here, are amplified. It says the famous people that were born with a birth cow, birth sack, that people that were born with a birth sack around their head were Sigmund Freud, Lord Byron, Napoleon, then you pronounce it as what?
Shalman.
Okay, Shaluman.
It's a phrase, yeah.
Okay, Shaluman. These are the famous people that were born with the cow. So there are myths that are associated with this one. There are myths that are associated with the, let me just put it in the normal size. Okay. It says myths associated with the cow births. In various European mythologies, it is thought that a babe born in a cow is incapable of drowning. Okay, the cow bearers, as those born with a cow, are called, were said to act as a ward against drowning as well, and their cow became a much desired artifact for sailors. So this is in Europe, says, okay, for you to become a best sailor, they are picking those that were born with the best cow. In medieval times, being born in a cow was interpreted as a sign of good luck and that the child was destined for greatness. Saving the cow was considered an important tradition of childbirth. The midwife would rub a sheet of paper across the baby's head and face, pressing the material of the cow onto the paper. It would then be presented to the mother to be kept as an heirloom. Some early modern European traditions linked being born with a cow to an ability to defend fertility and the harvest against forces of evil, particularly witches and sorcerers. Okay, famous people born with a cow. These are the ones that I mentioned. This one at the Charlemagne, Napoleon, Liberes, Lord Byron, Sigmund Freud. And we know Sigmund Freud, these were genius people, the genius people. If you talk of psychology, you cannot leave out Sigmund Freud. Napoleon, again, these were wicked people, but he was very genius, Napoleon. Okay. So we go now, if there are no questions on the birth cow, let us talk of the fontanelle, chapamutu. Aye. Okay. Yes, fontanelle. Okay. Okay, I go like this. I don't know if you are seeing. They suck.
Yeah. Yeah, now others they come out with it.
Okay, you can ask a question. I don't know if this person.
No, that's
Okay.
yes, questions for the study of the instrument.
Oh, okay. Okay, so fontanelle is this one. It's totally this one. I don't know if you're able to see it. So it looks like. So that's yeah. Are you able to see? Huh? Yeah. Hello, those who have joined. Hello? If you have questions on the birth cow. Who is he? Sister Leandro, can you mute yourself? Hello?
Okay.
Sister Leandro? I don't know who is.
Yeah, you can mute yourself, Sister Banda.
Yes. Yes, you can mute yourself.
Hello.
Hello, we're able to get you, but we want you to mute yourself.
I can hear
Yeah, your phone, you can mute yourself, Sister Leandro. Your phone is making some sounds over here. So if you can just mute yourself. We are trying to mute you from here, but we are failing. I don't know why we don't have the
claim host.
Yeah. Let's try to come again.
What of this is claim host? Who is it?
Then we can have the power to mute. And we have to do this sign. We don't have them. We don't have the power to clean the she's able to hear us, but I don't know. Sister Leandro, you can press on the mute button on your phone so that we reduce the feedback. Okay, just continue, Brother Keagan.
Okay, fontanelle. The chapamutu or fontanelle, it says enlarged fontanelles are larger than expected soft spots for the age of the baby. The skull of an infant or young child is made up of bony plates that allow for growth of the skull. The borders at which these plates intersect are called sutures. The borders, I don't know what to do with Sister Leandro. Sister Leandro.
Yeah.
I think the best would be to call her line and tell her. Maybe someone can privately call her and tell her that once you log in, mute.
Okay, I've muted her now.
Mute yourself. Mute yourself. Okay. So chapamutu says the skull of an infant or young child is made up of bony plates that allow for growth of the skull. The borders at which these plates intersect are called sutures or suture lines. The spaces where these connect but are not completely joined are called soft spots or fontanelles. The spaces where these connect but are not completely joined are called soft spots or fontanelles. Fontanelle or fontanelle or fonticulus is what these are known. So there are the different types. There's this fontanelle here, as you are seeing here on the skull. There's bony plates. This is the bony plate. Then we see the fontanelle here. Hello? Okay. Are you seeing the screen, Sister Chimuka?
Yes, I can.
Okay. So these are different types. This is the anterior fontanelle. Okay, this is from this angle. Okay, so this is where the occipital is. Occipital, posterior fontanelle. Okay, this is so we see that babies oftentimes this chapamutu chimankalira pamwamba na kumbuyo where is near the occipital. The occipital, that is a spot where you can send someone to sleep here. So yeah. So we see ichi chinkalira hapa. You see pants hapa. Occipital hapa hapa. So when you touch here, pamangala poteka pamwana, very soft. Then here as well. Huh? So there are two. The reasons why God created it in that way is because the 10 centimeters is too small, though it's a maximum expansion of the vagina dilation, but the head of the child, it can burst. So God put spaces so that the head can be shaped whichever space according to how the child will be effaced from the birth canal. Okay, so that it doesn't burst. That's the reason others, the children, they are born with a certain, we can call it what, I will not use the word deformity, head, a certain shaped head, but once mukamba kuisina, you do my fermentation ima bwerera mujani munomo position because of the fontanelle. Okay, ima bwerera munomo. Okay, so we see how wonderful this is from the sperm going to the time when the child is delivered. It's a miracle. Even how how the child eats through the placenta, how the child is developed and born, the features that the child has. We learned of the white stuff that the child has. That is to prepare a child for its autoimmune system. That is the microbiota. The lesson that we learned saying the microbiota is imbued in the butter-like cream which the child is born with. Then they eventually eat the same. Okay. Then we see that the immune system of a child is very built. Then as we advance with this lesson, we discover that also God put something in milk, in breast milk, which is totally different from the breast milk of cow's milk meant for a calf. Totally different. And I think I'm going to share also a website. I don't know if it's still there. I haven't checked. The last time I checked that website it's a long time, but they were dedicating to discuss that it's no longer time to drink milk now. Okay, time has passed to take milk. The reason being is that because milk of today is that they use what you call breast pump. So breast pump can pump milk with blood. Milk of the udder, udder breast, the breasts of the cow, they are called udders. So they can pump breasts, they can pump those udders with blood. Okay, then milk is composed also, blood is there. You understand that? Okay, so then the people that drink it, then it is connected with somatic cell count. Somatic cell count there's pus and some infection. There are a lot of hormones involved in it. So a lot of pus so in milk there's bacteria, there's pus, and there are hormones involved. Okay, and a lot of blood. So what they do, they purify it. They purify the milk so that it looks white. It goes through my processing so that they make it look presentable to the people that buy it. So they are agitating that. And also the constituents of milk. I think these are the only ones that still have that data, because today, when you check, I don't know those people who've been hand in hand following the net, discover that once you check information, as you advance, they alter the information. They alter the information. You no longer see it, or they will change the information. Because the last time I checked on the milk, it discovered that cow's milk has more of omega-6, and it is meant for a calf to grow very big in 3 weeks. Okay, that's the reason the child, when you submit the child in taking breast milk, the cow's milk, the child will grow very rapid. The child is going to grow very rapid. The child is going to have what you call mucus problems. The child is going to have diabetes mellitus type 1. The reason being is because once you introduce the child in taking milk, and the milk, their sieve is less, the absorption rate of the, when they check the bottles, the absorption of the food, especially the milk, those who are on formula, okay, so they cannot digest, and even their absorption, the bottles of the breast milk absorption versus the cow's milk absorption is different, because in breast milk is loaded with omega-3. There's high omega-3 versus cow's milk. Cow's milk has the high of omega-6 ratio, okay, but it has omega-3 as well. So then their fat, the fat which is in cow's milk is high compared to that which is in breast milk, human milk. So a child, since what causes diabetes is what? It's fat. What causes diabetes? Most of people, they don't agitate this. In medical school, they learn saying diabetes is the abnormal metabolism of fats, protein, and carbohydrates. But what causes it, they will not tell you. Okay, they will just tell you saying maybe it's genetic, and maybe you are born with it, and your lifestyle. But basically, what causes it is the fat. So if you introduce the child into taking fat, I don't know why I'm talking about this. You introduce a child in taking formula when the child is born, meaning that formula, that fat which you've introduced the child to be taking, is going to cause diabetes mellitus type 1. Diabetes mellitus type 1 is no insulin production. The insulin is there as a key to open for the glucose, to enter into the muscle cells. Insulin also is there for converting glycogen, stored, what you call reserved energy, into glucose, into energy. Okay, so there's glycogen, reserved food, which when you're starving yourself, you're not eating, in the time of fasting, the body can convert that glycogen, that reserved food, into energy. The same insulin, again, there's a time when you do not have carbohydrates, it can convert protein and fat into energy. So when there's no insulin, that is type 1, diabetes mellitus type 1, there's no insulin. Insulin caused by what? Okay, caused by excessive fat that you introduced, you did introduce into a child when the child was born. The child will be born with what you call diabetes mellitus type 1. Okay, because of the fat that you introduce into the child. Instead of the child developing, I had a case, there's a certain woman, first she called me saying, okay, well, let us treat constipation. The child had constipation. Then she was bragging saying, oh, my children, they don't breastfeed. Actually, when I introduced formula, they stop liking breast milk. They don't like it. And they once again they introduce is it Delight or Cerelac, they will not completely, they will stop breastfeeding from the mother's breasts. So eventually I wonder, saying, okay, your child, they're going to have what you call fits, because omega-3 is what develops the mind of the child. Omega-3, and is found in milk, breast milk. So the child is going, the brain is not going to develop, and also the child was suffering from constipation during that time. So we did enema. Eventually, the child started going to the loo. Then later on, she called me saying, okay, I'm now a child, my child is suffering from fits. Okay, so I'd mix molasses, then I'd put aloe vera powder there to help alleviate the constipation of the child. Then she started using molasses on the child that was experiencing fits. Then she saw that the molasses mixed with aloe vera helped or cured the fits. It was very simple. The reason being is that because molasses has also omega-3, it is also loaded with B vitamins. That's the reason the child was helped. Okay, so there are people, there are children. So my emphasis is this: for the baby's development, you have to introduce omega-3 to the child. That's the reason if you are not giving breast milk, or the child is failing to take breast milk, please. Others they find whatever means they can use. They can buy linseed oil or flaxseed oil. It's loaded with omega-3, or they can look for something that has omega-3. Okay, to give the child so that the child has the complete development of the brain. Others, they will resort to fish oil. Fish oil is not good compared to natural oil. Fish, yes, fish oil, it has omega-3, but its omega-3, it cannot be compared to natural omega-3 from flax seeds, soya, okay, soya milk, and breast milk. So we should resort to that which is natural. That is the part which I wanted. Also, it will cause, because what will develop this child, the brain of the child is omega-3. It's what is going to develop the child. The mental, if you want the child to be born dull, if you're giving less breast milk or you're giving less omega-3 of the child is going to be very dull. Eventually, the child will be even have fits, will be a dull, stupid child. Okay, stupid is an IQ, or it's in the IQ. The child meaning is has low IQ. Okay. So those are things that you have to understand.
Just where you mentioned the aloe vera and the molasses. For molasses, at least you mentioned that there is omega-3. Then aloe vera, what are the properties in aloe vera? And why is that combination the best?
No. In my narration was that I was treating the child. I use aloe vera to alleviate constipation. The child had constipation. You know, when you introduce the child to food, then you deprive the child to breastfeeding, from you deprive your child from giving breast milk. The child who prone to have constipation, amadwala mumala mwana aleka kwenda ku toilet, kapena simumpasa breast milk, mambo you introduced food like delight na vama formula amadwala. So this child has had that. So me, what I followed constipation. Okay, so this constipation, so I prepared molasses and I put aloe vera, and I went to do an enema. That's what I went to do. So, but I had warned her saying, because of what you do, your children can prone to have fits. Okay. So what happened is that she used that aloe vera, I mean molasses mixed with aloe vera on her child to control constipation. Then the child developed yes, the other child, he had two. The other child developed fits. So she started using the same one which was using on this one started using on her child, that other child. Then it cured the fits. The reason why I was putting it was because the child did not understand that if she's not breastfeeding the children can have fits. The reason being is that because in breast milk there is high omega-3, and she should do that. Because if a patient was to come to tell me saying the child is suffering from, because we had a case where a child was suffering from, had a stroke, was born with stroke. The child was born with stroke because the mother also had the fits. You know, if a mother fits and suffering from fits, the child also is prone to be born that way. So the child was born with a stroke. So every second the child would fit. Okay, would fit. Every time the child would fit. So at the hospital, they gave the child a lot of drugs, and they put the child on a ketone diet. I don't know if you've learned of ketone diet. Ketogenic diet, it has come now on the stage. A lot of people are tempted to do ketogenic diet. In 1972, what was the name? Atkin, a certain man, agitated, just, you know how medicine, they manipulate medicine. Those who have the chance to learn what is involved in medicine, they know. This Atkin, there are a lot of darts, of course. So there's what you call Atkins dart. Today now is a lot selling. They learned on digestion. So they saw that when you eat food, carbohydrates is the one that is going to be converted into what? Into glucose, into energy. Okay. So what Atkins studied, he said, okay, carbohydrates. So let us make people stop eating carbohydrates and let them be eating only protein and fat. So Atkins' diet is making people to eat a lot of protein and fat. So that the child was introduced to eat ketone. I don't know if ketogenic. They call it is it basic panting? I don't know if they call it like that, but it's very known now today. Where a lot of people, they want to lose weight, then they'll just put on themselves. They stop eating carbohydrates on sima. They'll just be eating a lot of big meat. Okay, I don't know if you've seen it. Who come across that? Okay, you've seen that. Okay. So it came during that time in 1972. It caused a lot of deaths because there was no fruits and vegetables. But when they came back with an apology. They added fruits and vegetables. But still more, it doesn't work because the body wants what the reason why we eat is for energy. And we get energy from where? From carbs. That's the reason we eat. That's the reason the body, when there's no carbs, it will work to convert fats and protein into carbs, into energy. Okay, that's the reason those people who are in that keto diet, they are weak, ever weak, and they have heart problems. A lot of them. Okay. So the child was put. So I told her not to follow the keto diet. So we started giving the child what you call, we started making pumpkin seeds and flax seeds butter. Pumpkin seed and flaxseed butter. And we put flaxseed oil. These were just basic. I told her, you're going to cure your child using just this. Then the child was cured, stopped fits, just using. The reason being is that because flaxseed is loaded with omega-3, pumpkin seeds also is loaded with omega-3 and zinc for brain development. So the child stopped fitting just using that. Okay. So omega-3, it plays a big role in the development of the child. I've overemphasized this one. Any other questions?
Yes, I wanted to ask a question. So now for a child that is intolerant to soya, what would you supplement with?
Okay, I've mentioned in my speech, I've highly talked of what you call flax seeds, omega-3. Omega-3 is loaded in flax seeds. So you can give flax seeds. If you can't find flaxseed oil, you can use flax seeds, the actual seeds.
Okay.
Hello?
All
The
right.
reason why you are mentioning soy, why are you mentioning soy?
Because my child is each time you like I still give her, but each time you give her like soya porridge, she diarrheas afterwards.
Yeah, so it's
From I even
intolerant.
saw even when she was I was breastfeeding her, but because I go to work, I used to give her formula. So there was a time I bought her the formula that had more soya. They sell that. So I started giving her, then she should diarrhea or get constipated. Thus I had to put her off that one and took her back to the lacto one. So I've
Okay.
noticed that
Oh,
each
so
time
what
I
blood
give
type
her
is your child
soya,
now?
it's either diarrhea. She's 2 years,
And say
7.
the blood type.
But even now, I make porridge, I put soya, she'll always diarrhea afterwards.
What blood type is your child?
I need to check. Oh my God. I need to check on her under 5.
Okay. So if you want to balance, you have to introduce the flax seeds. Flax seeds are the ones that are going to control the child, or the omega 3, alpha linoleic acid. Okay, it's the alpha linoleic acid is omega 3. So you have to introduce flax seeds to your child.
All right.
So basically, it also control also constipation. It also help to develop the brain of the child, and the child now has grown, no longer on breast milk.
No, she's no longer on breast milk. She stopped at 1
Okay,
year
so
7. Yes.
okay, but the child can take what you call is not intolerant to what you call groundnuts.
No, she's not.
So meaning that you can be making the butters like the way we do. We get the flax seeds. The flax is or linseed. Flax is called also linseed. Flax seeds and pumpkin seeds. The pumpkin seeds, then we get groundnuts, then we roast. So we roast flax seeds on its own, then we roast what do you call pumpkin seeds, then and we roast groundnuts, then we make butter. That butter, then you'll be putting in porridge, then you give the child. That is the best.
Okay, I'll call you on the side on how to make that butter. I don't know
Okay.
how to make that.
Okay, thank you. And others, if you again you want to make it a bonus, you can also put sesame. Sesame is for the bone development of the child. Sesame has a lot of calcium, so we'll discuss. Okay.
Okay.
So considerations. Fontanelles allow for growth of the skull during an infant's first year. I don't know if there are questions that I was talking about, if there are questions on that. Okay. Okay. So, hello, Sister Olivia. Sister Chimuga says, Sister Olivia, to cure food allergy, the child can be put also on watermelon so that it cures the food allergy.
Okay. All right.
Yes, I can. So me, I didn't know of that one, so I've learned. So, to cure food allergy is to give someone watermelon. Okay. Okay. Says watermelon is also good for pure circulation. Poor circulation and the constipation. Actually, watermelon, when you are studying, it is good for the brain. It says the water that is in watermelon, it is found in the brain. Okay, so it's good for that water that is for the development of the brain of the child or any person's development of the brain. Watermelon is good. Okay, because of this, the water which is found in the brain is similar to that water which is found in watermelon. Okay. So fontanelles allow for growth of the skull during an infant's first year. Slow or incomplete closure of the skull bones is most often the cause of wide fontanelle. Slow or incomplete closure of the skull bones is most often the cause of a wide fontanelle. Why do babies have soft spots? Though it may seem as if your baby's soft spots were put there to make you anxious, they actually play an important role. Those were chapa mutu, it was spelled mazimai. The fontanelles give a baby's head the flexibility it needs to squeeze through the narrow birth canal. It's the one I talked about earlier, which is why a newborn can look pointy headed for a little while after a vaginal what? Birth. Kamutu kosongoka so face. Then mambo ife sina then mutu ambubwere mo munomo. Pena mfuna kapena manje ambopana kapena ni amwale ambubwera mu amwale mutu. But face anga. Kulibenango the others that say tubana udutuma bado tichibanda manya wada badika ituma bado tuli white kamutu but ukampukuta mwana omwika ku oxygen omwika paja paka mama dena tikaza ka light ka joro omwika kuzuo ndaba tiyankara manje muntu kapena una mwanta ungakagwese tose kama ago baja so ufuna konkhala ndolimba baja ma midwives ma local midwives baja mazimaya nukhala olimba kamwana uda bado uona fulati nchisomba chichoka yeah ona vijava cream futi kamwana white so wafunika so zaka pukuta bakashita chano wakaika kapena kena kabadwa yellow blue kaili oxygen so wakaika kuzuwa daba mayata ndiye kamuntu manje hapa manje kakhala kamuntu yeah.
So like in that case, like we have learned, that process of them trying to remove all the cream, they actually worsen the situation of the baby.
Yes.
Because we saw that some of the cream needs to be on the baby at least for 12 to 24 hours. Right?
Yes.
Yeah, so they need to be educated. It's good that we are learning now.
Yeah. Wankala yero. Ni karibu inverabu. I don't know if it has science behind it because chayero is just a color. Ati afunza kuti ati mwana akapadwa. Oh, sorry. There are people who say that when a child is born, we should not clothe the child materials that are in color yellow. Okay. So how true is that? Sister Chimuka, you can comment on this one, or Sister, because me, I haven't heard of that one now. Have you ever heard of this one, Sister Chimuka?
Nikaibongera nini?
Kapena ni wandani ndivaja, kapena ni ma tradition. It depends with a certain place. Because color yellow, wakama kuvalika makarabwa, but not yellow. Okay. But I know of a child should not be, there are children that are born blue. yellow. So when you check, they check the skin when the child is born, because they are. I'll talk of this one also. They will check they check the skin. The child should not be born yellow. If it is yellow, the child has been born with jaundice. Okay, so
Yes, that's
jaundice.
what I wanted to tell. Maybe si jaundice chabe, your man.
So jaundice. So veve bakudalo just associate color yellow na jaundice. So the color yellow, it has nothing to do with jaundice. Okay, it has nothing to do. So that's the reason they would expose a child to sun, okay, or kumpasa mukwala wajani or uzaletesa oxygen. Uzaletesa oxygen, because jaundice is to do with the liver, okay, and the bowel. So in olden time, they say if a child is born like yellow, it means he'll be choleric, more of choleric, because chola is another, it's an English word for yellow bowel, chola. Actually, we read it in prophecy where it says that what is it the he goat or which goat came with chola? Is it the he goat or the ram came with chola? So these are choleric. Choleric people, you know, they are short-tempered. You know, those who are, yes, those who have short temper, they have excessive choler, meaning they are prone to suffer from fevers, jaundice, and other conditions. That's how they were studying medicines olden times. Olden times, they were just studying medicines, looking at the temperaments. If a child, if a person has, like me, I'm blood type B, so I'm intolerant to some, what do you call, a lot of food, you know, or we say I'm sinusitis, I have sinusitis, mucus production, you know. So a lot of issues to do with the food. If I eat between meals, I have mucus. If you've applied some perfume that I'm allergic to, pesticides, I'll be yes, blocked in the nose. Okay, and the blood type Bs, they like a lot of milk, like the milk they like is cow's milk a lot. So there are those things, but they are intolerant to chicken and the, what do you call those who eat chicken, and the duck. They have a lot of belly fat. So there are those things. There are those things which, why was I talking about this? Okay, the yellow stuff, huh? The yellow. The reason why I'm talking of this is the yellow stuff. So there are people who are born with a lot of mucus production. So mucus production, that is phlegm. Phlegm, it is phlegm, it is what? There's choleric, phlegmatic. Phlegm is phlegmatics. So those who have a lot of phlegm, mucus, meaning they are phlegmatic. So even how to handle, to treat them, you have to give medicines that are expectorant. Bijavimvima chosama nkololodia. Munkwala wa mino chosama nasa vikolala. Ndiye munkwala wo treating abajamuona wana wamankala manyingi na blocked. That's how to treat them. Those that have issues to do with the yellow or another yellow mwana was born yellow or had jaundice. Mucus, yes. Yes. So these children, most of them who have at the hospital, they say have asthma or bronchitis. Okay. There are a lot of them. Others, they will even develop polyps, nasal polyps. Okay. But because it's their data, they haven't studied their blood type. So if there are a lot of patients that would come to me, they say they have nasal polyps. I'll ask, what blood type are you? They'll say it's B. Okay, I'll tell them food not to eat, food that causes mucus, mucus production, and they control that, and we give medicines, expectorants that will what you call decongest them. So basically they will be cured if you handle it in that way. I think that's the reason I didn't want to answer that question. It's because I was to go now to yellow. So yellow people, those who have a lot of fevers, they were giving them medicines to handle the liver and the. I have a friend who has issues to do with gallstones. Every time the gallstones, but most of the people have gallstones. They don't know how to flush gallstones. I'm going to tell you how to flush. Gallstones is very easy. At the hospital, they say it's a surgical procedure or leave it. Okay. But gallstones, you can flush it in 2 days. The gallstones are flushed, then you're able to see them and send them to the hospital. After 3 days, you just carry them and send. Then say, do a test, my gallstones are gone. We did it in a certain woman. They wanted to operate on her. So she just came, we flushed gallstones 2 days. Then she went, they checked, there were no gallstones. Then she said she was very happy. Then she needed to do the same procedure again. To do the same procedure. No, they don't care. They don't care. The rival is this. See, the rival, you know, the competition is this on the market. I learned it when we had a friend, he was I think I will not mention the name. When they had a meeting, a pharmacist. So they have the meeting of pharmacists. What they discuss, first of all, discuss again the rivals. Who are the rivals on the market? It's the herbal people. So the rivals of drugs are the herbal people. So they are going to talk on how to curtail the herbal people, because those are the rivals. If, for instance, you're a politician, you have to talk against your rivals and how to curtail so that your business booms. Yes, you have market. So they are talking bad of the herbal people. There's a time when I was listening to, is it the one who is dedicated is Mike Grigger. Michael Grigger, he presents clinical trials and what they find. Okay, that is he's talking about nutrition. So the nutrition. So there was a time when he brought about the issue of the time when they found that an apple, it accidentally fell in poop. You know, poop, there is what you call E. coli. E. coli. Okay. Because naturally, in fruits, there's no E. coli. E. coli is found where? In animal-based food or poop. Why animal-based? Because sometimes the body can absorb poop into the bloodstream. Okay. So the apple fell in the poop, you know, like harvesting, it fell in poop. The people discover that in an apple there was like someone ate the same apple, then was found that he had E. coli, infected with E. coli. Okay. So then he said, So it went, that news, just the news saying what caused the cholera or this condition. It was what do you call an apple. Okay, it was an apple. You know, such news. If things which they are against, then is the cause of a condition, the news circulates. Even when you hear saying that wamahebo apa ya muntu, the news, the way it will circulate. But when they kill someone, do they say? No, it's silent. Yes, because we learned saying it is number 3. They even know, even on the net, it's not a secret, saying drugs is the 3rd leading killer of death in the world. 3rd. Okay? But the muntu wama ebzo mo, or sabe kutulula, kulikaza kutulula moja, the babado seed. Babado seed. Someone saying took babado seed. Anatura kwenda ku toilet. I mean kwenda ku hospital manje kumweka drip. From there, just the news of causing diarrhea, babado seed causing diarrhea, it has gone everywhere. Those to seed too paya tuja. Tunga kupaya. Those to just small seeds, babado seeds or jathropa seeds. But it is a very good, it's a very good cause. If you are diarrheaing and you see that you're diarrheaing, there's a poop coming out, you're supposed to be happy. But you're upset because you're diarrheaing and you want to be keeping the poop, to be walking with it everywhere. That people are scared of diarrhea.
Yeah, so you said you help us understand the simple remedy of removing gallstones.
Oh yeah, it will be a bonus. Let me finish.
Oh.
Okay. There are no questions there down. Huh? Today I was diverting there. Yeah.
Yeah, today you have done it. But yeah, you are enjoying. And like Brother said, me, I was even proposing, say, let's next week just deal with those kind of combinations, because that is also part of our health education. Maybe we finish with this one.
Ano izaka buena. This time we're now learning able. But that is a bonus. Though it may seem, what is this? Why do babies have soft spots? Though it may seem as if your baby's soft spots were put there to make you anxious, they actually play an important role. The fontanelles give a baby's head the flexibility it needs. This one I've read. Yeah? Okay. So, which is why a newborn can look pointy-headed for a little while after a vaginal birth. After birth, they stay open long enough to accommodate your baby's rapidly growing brain. Okay. In fact, on one way, your baby's pediatrician, as we don't know which province we came from, some other way if you want to read. Pediatrician will check your baby's growth and development is by gently feeding her soft spots. Okay, causes. Larger than normal fontanelles are most commonly caused by Down syndrome and these others. Hydrocephalus, intrauterine growing retardation, premature birth, rare causes, and these others. Let me, okay, and other causes. When do fontanelle close? When do fontanelle close? Your baby's soft spots won't stick around forever. Eventually, the bones in her skull will build up enough minerals to completely fuse together, and those gaps will close. The smaller back fontanelle typically closes by the time a baby is around 3 months old. The smaller back, this kaoko, kama varika fast mazira kaja kaoko mkagwira. The smaller back fontanelle typically closes back the time a baby is around 3 months old, but is sometimes closed at birth. The top one, however, may stay open well into your baby's second year to give that amazing brain the shape it needs. Sorry, the space it needs. So it will close in 2 years' time. The top one. So the top one, however, may stay open well into your baby's second year to give that amazing brain the space it needs to grow. Though by the time your little one turns 18 months old, it should close up. So there is why you should now worry. because fontanelles, they are like signals now. Fontanelles are signals, whether a child is sick or not. Be able to see. Say pulsing or bulging soft spots. If you notice your baby's fontanelle seems to puff out when she cries, concentrates on a poo-poo or vomits. Okay? Don't panic. So these, they can be indicators. They can indicate that the child is sick, has constipation, or has some condition. These can cause extra pressure to enter the body, making the fontanelle bulge out a bit. If the fontanelle goes back to normal when your baby has calmed down and is in an upright position, then all is well. Your baby's fontanelle can also appear to pulse or pulse, give a pulse, whether she is stressed or totally relaxed. Okay, luckily it's not a cause for concern. The temporary lack of heart covering means you are simply seeing your baby's blood pulse along with her heartbeat. When to worry about baby soft spot or fontanelle? Normally, a baby soft spot is firm and caves in just slightly, but call your doctor right away if you notice these rare but possible signs of trouble. A dramatically sunken fontanelle, changena chapa moto. This can signal dehydration. I had, there's a time when, I don't know, at the hospital, I witnessed, there's a time when my mom, I had a brother, then the child, I think it was 1 year or so, then had chapamu chachinangen. So what she did, she took the child to the hospital. They start to the hospital. Then there's a time when I'll not talk of what, because that time I was now against what the hospital had done. So when they took that child to the hospital, the child, I don't know if they did injections, strong injections, the child did not survive. The child passed away. But the child, the possible side that we saw when the child was taken to the hospital was the chapamutu chinangen. That was the only concern. And mothers, bakaona chapamutu changena, mama rashinga kusajana. They find the solution, much. Okay. So the same thing we needed now to repeat, enough na free kwela. Now that hey, mkaenda azafa mwana. She did not do. Okay. So it is the same thing here now. It says a dramatically sunken fontanelle. This can signal dehydration, especially if your baby isn't eating or drinking well and is having fewer wet diapers than usual. You see now what would cause this? Okay? Understand? Others says because munipenda rama zogula madaipa. Mumusunga mwana madaipa. For a long time. You are giving a child in diapers for a long time. And actually the others that they're even proud. To me have money. Then they buy Huggies. At Huggies, it stays a longer time, longer period. But you are killing the child. Because the child, you have to be changing. If you're buying diapers, at least you have to be changing. You have to check. You have to be changing. Maybe in a day, you change maybe 3 to 4. Others do 5 diapers per day. You're changing the diapers. So that you do not, because we learned, remember when we were learning masturbation also, it says diapers can cause what? Masturbation. Itching, then now the hitness, it will begin now to tickle the private part of the child. You understand? So the other causes. So it says a bulging fontanelle with flu-like symptoms. This can sometimes indicate increased pressure in the brain due to head trauma, an infection or fluid buildup, especially if your baby has a fever and is unusually sleepy, if you notice a bulging fontanelle along with a fever or excessive drowsiness, seek medical attention right away. So basically, these are small things that you do. You tell them, I tell them just you use simple things. Depending how old the child is. If the child is 2 months, 3 months, you can give, or 0 months, you can give catnip. That's the reason most of people, they need to look for catnip. They need to look for catnip. If you do not have catnip, you can use rosemary. Rosemary doesn't have a herb on a child. Rosemary is very good. Okay. It's infusion. Those are infusion. Infusion, umpasa to my spoon, man. Umpasa to my spoon. Then there's a way on how babies suck. Can't just do cup a spoon. Is a more calmer. Alright. Okay. So small conditions. Like there's a time when you can introduce, like at 3 or 4 months, you can be giving a child that has this flu-like symptoms. You can do garlic, fresh garlic, boil it. It's penicillin. It's a strong penicillin, garlic. Okay, just garlic. It is very strong. It can cure whatever conditions. Even when you check, okay, magula panad or trifen or whichever, how long is it going to take to cure the child chifu? It takes, basically, if you notice, you discover that a garlic, if you give garlic, all the fever symptoms are going to go. Maybe I'll start to kukola. The child will be coughing, but coughing, it is, in medical terms, it is helping a child to expectorate, to remove makola. All the temperatures, if they've come back to normal, meaning infection is done, now the child is expectorating, is removing mucus. And mucus, if he's removing mucus, meaning is removing infection through the what? The spider webs or mucus is removing, the child is removing. Now you want to stop the process of expectoration. That's what we try to do. Okay? But let the child do. Akasiriza, then you'll see that the child, because the child did not have any fever. Temperatures were all normal. Okay? Headaches was no headache, because the infection, the body had fought infection. The reason why we would see what you call fever, low and high, is because the blood, the white blood cells, they engulf, they regroup, then engulf infection. Once they engulf, first they regroup, they go to regroup. There's low temperature. Then when they go to attack, there's high temperature. Then again, they regroup, low temperature. That's what it is. When a person is sick, we call that healing crisis. Okay, healing crisis. So they regroup, fight. Then what we do is that we want to prevent that from happening. We give medicine to make the temperature come to normal. We are preventing that from happening, from the body attacking, okay, the infected part. We should allow that to happen.
So, like, yeah, in that case, Keagan, this lesson is important because if we notice a child or even an older person develop a fever, how long should we wait before we administer any medicine? And then, if like you have said, for me it is a clue that if somebody is in a more like a fever, then suddenly the body heats up, I will know that okay, maybe the white blood cells now have started fighting because I can see the fluctuation. But the question is, how long should I wait between the two? When should I help when the body is cold? Like how long should I wait? Or if the temperature also is high, how long should I wait before we administer medicine? Because like you are saying, we may prevent a good process in the body because we are worried to say somebody's body has like developed cold. Or again, we may worry to say, oh, the temperatures are too high. Because I'm speaking this because we have acted ignorantly in that we have rushed children to the hospital. And when they give the medicine, you find that suddenly the fever tries like if he is in a fever, but futi body about overdose. Then futi suddenly you rush back the same child to hospital. Then when they change again. It's like now we start oscillating between two abnormal extremes, very cold, very hot. So maybe that's where maybe we need to seek some clarity to say what is the waiting window between the low temperatures and the high temperatures of the human body.
Okay. Because once the body is doing that, it means that it is curing. You have to know that there is infection. So you have to identify now. For instance, if a person has constipation, you see even excessive sweating, maramanyonga maningi. So you do excessive a person who there'll be a temperature fluctuating. So if now, if you are an informed physician, what do you do in that case? Okay, so Ellen White says, okay, use water. Water never fails. So in what case, what do you do now? You do enema, like in this, okay, chapamutu, maybe what is called chapamutu, kungena pants to sunken, is because of constipation. The child doesn't go into the loo for maybe 2 weeks. Okay, so what do? You do enema, or you cause the child to go to the toilet. Then you discover that once that part which it was attracting the blood to go to that area to help alleviate that condition, it has been relieved or decongested and toilet, then the child will be what? The temple calm. Okay, now let us go to another condition. Maybe it's what do you call it? The other condition is not maybe to do with the mumala. It's other just condition. Tabuera or what is this? Fever, that those my fever and colds, flu. Us olden times, we used to do like this. Our parents used to know steam inhalation, but that steam inhalation is not steam inhalation that we knew. I learned that it's not steam inhalation. As what it is called steam chair sweat. Steam chair sweat is very good. That's the one which we are doing. Steam chair sweat. It's not steam inhalation. Because I told them, saying, okay, can you demonstrate what we would do? Most of them would get a blanket and they boil a lot of medicine in the pot. Okay, then there's this steam. There's a difference between steam and vapor. Vapor is cold, steam is hot, very hot air. Then they'll get a blanket and cover themselves. Once they cover themselves, the entire body will sweat. It's not only the face no, it's the entire body. So what is, if the body is sweating, excessive perspiration, it means that you are now triggering the blood to fight that infection, white blood cells to fight that infection. So once you sweat, matenda sezani ya choka. That's what they used to do. You see, that is the other way. They used to know that. Okay. But okay, this steam chair sweat. Steam chair sweat. Steam chair sweat. Today, even mawazungu, you go in this. If you just say steam chair sweat, they are now selling like something that is where a person can enter inside, then it hits person. Even there are even rooms. Yes.
Sorry, my brother, Nasadila Kwenze Chongo. I'm seated outside. On the part where for the constipation, giving water, how do you give the water? Just drinking the water? Like, how do you give the baby?
No, I said hydrotherapy. Hydrotherapy, you do enema. Enema is very simple. You buy a syringe. You can do a syringe that has a nose. Or you buy an enema bulb. Kapompero. Kaja wenzo chita makoro wano kuli imwe.
Kumbuka bwani nze mwana.
Okay.
So you syringe, then you insert it. That's what you mean?
So in a syringe, what you do is that, so you study the water temperatures. The cold temperature allows constriction of blood vessels. Then hot allows dilation. So what happens is that when you mkambira manzi yokupya so kapena, if the child, what was causing constipation was less water, you discover that that water the child will absorb. Because we did it once to a certain man, we didn't learn. We just said, okay, it's enema. We just go and do enema. Right? So we put hot water. We're waiting for poo to come out. We're just waiting to no avail. We waited 0. Meaning that the person was severely dehydrated. So once we put that water, the body absorbed the hot water. So okay, then we started. Then what went wrong? So we started now studying the temperatures of water. So you have to know, saying, okay, the ideal part is to first use hot water. You put a bit of salt, you can use Epsom salt. Epsom salt allows a lot of water to be in the colon, I mean the large intestines. Or you can put a salt, you can put a bit of cayenne if you want, or you can put whichever medicine that you have, or ginger. There are a lot of enema what people they use. They can use ginger in the enema, okay, infusion. So once you can use hot. Once you use hot, then the body will appreciate, okay, warm. And if you want to if it does not come out again, the second time you repeat with you room temperature or cold, you do pap, then you'll see poop. It is fast. It is very fast. It is actually, it takes seconds. It's just seconds. You see the child will be pooping. Hello? Are we together?
Yes, I was typing. As you are talking, I'm typing on my phone, my note.
Okay, and again, there's another one. Our olden time mothers also, they used to use castor oil. Castor oil is very good for for constipation. You give a teaspoon on a child, but if adults they can do 3 tablespoons constipation. Children, a teaspoon. It's ideal. Teaspoon or 2 teaspoons. Like a babe, 6 months, 3 months to 6 months, they can do a teaspoon. But if it's like 2 years or so, it's a tablespoon. It's ideal. Constipation. You alleviate constipation in 0 minutes. Hello? Okay.
All right. Okay. Thank you.
I remember tomato leaves. They squeeze them, then they make the child upside down. Then they try to squeeze the liquid from the oil, the same stuff into the backside or the rectum. Then within minutes again, the child will go to the toilet.
So they say now, yes, because the leaves of, So there are a lot of methods of enema. There are a lot of them. Others will use a soap, wangene circles.
That's the one I remember.
Soap. Soap it's nice soap. Soap. The problem is that it will disturb the bowel flora. Soap. Because it is antiseptic. It kills bacteria. We don't want things to destroy the bowel flora unless you have knowledge, unless you are going to give the child again, probiotics and prebiotics, okay, to refuel the bowel flora. But soap is very fast because the body, it will take it as a foreign thing. So it will want to expel, it will not absorb. That's what it does. So if there's a chronic constipation, soap, it will react very fast to remove. That's what it does. The colon, the microvilli is in the colon. Okay. Others again, they use, it says using tomato leaves. There are a lot of methods, but what we know, enema, then you can start, you can use anything. You can use whichever, as long as you have knowledge. And as long as that doesn't kill, there are a lot of methods to use enema. Others, they use lemon, others, there are a lot of things they use. Okay, it's just knowledge. Once you're knowledgeable, then it will be a cake. There's no other question. Huh?
I do have a question.
Yes.
In reference to the question that Brother Christopher asked about the window period for the temperature. So now what if the child is not experiencing the high and low, but just high? So at what point yes,
Oh,
like
high temperatures.
yes.
Yes, you
It's just
do. There's
going
what you
high.
call, yes, there's what you call now a contrast bath. So the solution is hydrotherapy. So hydrotherapy, there are methods. I don't know, I have to take that course because I said I promised I to do the short courses of hydrotherapy. Then you do now contrast. So the contrast, what it will do is this. The cold water allows constriction of blood vessels. It will allow blood. That's the reason Keagan did a lot of hydrotherapy. To the time when we are treating someone who has anemia. So we're saying, okay, anemia patients should do bath, not hot water. They should bath cold water, anemia patient. The reason being is that because the cold water will allow blood constriction to force the blood to form in the bone marrow. Okay, so there will be rapidity of blood production. Yeah. There's even a myth amongst us in tradition says mukazi afuko samba mazozizira kutankare young. Okay, and again, even footballers, they know for them to remain young, they need to do ice bath. Okay, wrinkles and okay. So, but the point is that the temperature now is high. What do you do now? You do contrast. So contrast, hot, hot water allows blood dilation. Okay, and once blood dilation also it it helps to bring blood to the surface and to fight infection. So now, if the hot is there now, so you have to do the reaction. You have to master just the reactions of these two, the cold and hot. The reaction of the cold, it is 15 seconds. Reaction of the hot is what? Is 3 minutes. You have to know that. Okay. So that's the reason these will be in the ratio according to reaction. So if I'm doing a bath, it could be a shower bath or foot bath. The one that is known most is the foot bath. Foot bath angene sambendo mumadzi feet. So there's a hot water. Hot water, you do 3 minutes. The body will react to hot. 3 minutes. Then you put the same feet in cold water. That is 15 what? Seconds. You see the reaction. So the body will react. So you're controlling the temperature. And this method can control whichever, if you have hormonal imbalances, you have headache, you have issues, even stroke and other conditions, this can control. Because already God told us saying, what cures is blood. In blood, there's life. So in the same blood, there's a lot of oxygen and a lot of sun. So if you, for instance, you have a condition, you are triggering blood to come to this area by putting in hot water, okay? By putting your feet in hot water, and these are meridians. In the same feet, there are meridians that go to whichever body parts. So then now, you put it in hot water, then you allow that blood to come to this area. And you put a cold towel on your forehead, and sometimes maybe on the heart, because the engine, according to the principles, those who drive, they know that the engine area is always hot. It needs to be cool. And the body, the engine area is the axial portion, it's spine, the mood. This is always hot. That's the reason when we go to discuss this one in dress, James White, they brought this discussion, says those who brought short sleeves, they aimed to kill us. You know, always we needed to be wearing long because these lower extremities are the ones which needs to be heated. Okay, if we reason this, we needed to be naked because these are high core temperature. So then now, when we allow that, we put hot, then we put cold. Cold, it will chase the blood which had come here. It will chase it up. Okay, so it will make blood to circulate and to trigger whichever point which is affected to heal faster. That is basically what we do in those people that have high temperature and you want to stabilize it. You do contrast foot bath or contrast contrast hands bath or contrast bath. Contrast bath, it could be the entire body you want to do in a shower and you are privileged to have a shower. You can do hot, cold. I don't know if you know it, how it feels. You do hot, you feel nice. Then when the cold comes, yeah, then you shiver. Then cold, hot, yeah, then you see the fever will come back to normal. I don't know if I've answered your question, Sister Tamuka.
Yes, thank you.
Okay. That one is very good. We used to do it, though. If you are privileged to have a shower, yeah. You can actually, when you learn hydrotherapy, you'll be bathing actually 30 minutes or an hour so that you benefit from the water. You learn hydrotherapy.
30 minutes or an hour.
Yes, you'll be bathing 30 minutes or an hour so that you benefit from the water. So that you'll be doing the same, like if you're doing contrast. So maybe you sit in water for some time, 15 minutes, you just sit in water. You're doing, and that's when now you begin to sponge yourself to some. Or if you are doing that contrast food, the contrast bath, it takes 30 minutes or an hour. Then now you're going to bath. The only time now to do that one is the time you're bathing. So you have to wake up early so that you benefit from that treatment. The one that we did, okay, a wet sheet pack. That is that's another treatment. That is another treatment. So there are different treatments. That one we're using it most in COVID. So it's another one. So when we're learning hydrotherapy, other people say, because I had a friend, we thought as if hydrotherapy, it is just putting your legs in water. Contrast food bath. Then they say, that is hydrotherapy. No, hydrotherapy is many methods. There are many methods. There's a time when you remember, those who read the story of Ellen White, the child, preventing the child from dying. Then she took the child to wake up on grass. So she did this on grass. She was rolling the child so on grass. So it did a lot in the child until the child came back to life.
What kind of blood?
It was my grass. House.
Oh.
Grass. Oh.
And she did what?
She was rolling the child on grass. A pig. Sure. I think you can read that one, that story. It's there. I think it's very common. I've forgotten the name of the child. I don't know if it is Henry.
In which book?
It has been bills. I mean, a long time. When I read that story.
Which
But
book?
the book is you
Yeah.
can find it in. May I read it from the magazines of Ellen White. There's a ministry magazine they published of Ellen White, talking about Ellen White, the story of Ellen White. But you can find it in Life Sketches of Ellen White. Life Sketches of Ellen White.
Okay.
Okay. Yes, Life Sketches of Ellen White. That's where you come.
Yeah, it's life sketch page 8.
Why page that? Okay.
So the conference was held at Battle Creek in May 1856. While we were very busy preparing for the meeting, I was startled by a scream of distress. My little Willie, then about 20 months old, was brought to me by Sister Fraser, apparently lifeless. While playing around a tub of dirty sacks, he had fallen into it, and had no one of his little feet appeared above the dark surface. He would not have been discovered in season to save him. His arms and face were purple, and he was entirely breathless. We cut off his wet clothes and rolled him on the grass, and he manifested a faint sign of life. We took him before a fire, and by heating flannels, produced some heat in his body. He breathed with difficulty. I kissed him, and he opened his eyes lucidly. So that is life sketch. Page 80. It is also on the life sketch. Oh, sorry. These life sketch, there are two. There is life sketch of 1880. It is page 321, paragraph 1. The same statement is also found in life sketch of life sketch of 1888, page 321 as well, paragraph 1.
Okay.
And also, this is the spiritual gift. Huh? Yeah, two spiritual gifts, page 207, paragraph 1.
I can. So I hope we've
Sorry, I'd
taken
like
notice.
the of 1888, page what? 31?
321. 321.
Yeah, he's
Both
not
are,
audible. Understand?
yeah, both are page 321 and paragraph 1. So it's
Oh,
recorded in
321.
life
Okay.
sketch of 1880 and 1888, page 321, paragraph 1 in both their books.
Okay. So tapunzira chapa pamoto eh. So a bonus. This is 12 what? So we learn a bonus. So that last time, next time we're going to learn delivery of the baby now. Delivery of what? Of the baby. Go down. How are the things, the requirements, the necessary things to what then? How to deliver the child? Yes, going down. Hi. Okay. That's what we're going to learn now. So here, the bonus is this one. Do you have not see? Okay. Maybe you'll be writing the notes now. So the bonus is how to cleanse the gallstones. Gallstones. A lot of people have gallstones. You have gallstones. Everyone has gallstones in here. If you're going to cleanse, you remember, you see, I was checking on this one. The drug medications for hypertension. I discovered that how they are cooking the body is this way. That's the reason I say this is very difficult to flush the drugs. These are they fall in the group of statins. I don't know if I'm correct now. Statins. The way the statins behave is like this. The gallbladder, it is responsible for fats, okay, or lipids production. It's the gallbladder, okay, and the what you call carrying or converting carbs into what do you call cholesterol. Cholesterol, it is a vehicle. They call it low density lipoprotein and high density lipoprotein. Low density lipoprotein is the one they call bad cholesterol. The high density is the one they call good cholesterol. But there's nothing like good or bad cholesterol. You have to know that. The bad cholesterol is the one, because since everyone has cholesterol, the purpose of cholesterol is to prevent arteries from rupturing, and they help, if the arteries are injured, they close the wound. And oftentimes this happens when, for instance, we put my drip, because tima tulasalasa kuja tuvibo, tuma veins, tulasalasa pa, kuti kangene kaza, tingenese, we what? Allow water to go into the what? The blood vessels. That is the role of cholesterol in the body. So the bad cholesterol is the cholesterol that you eat from animals, because that cholesterol, once you eat from animals, the gallbladder, it will be difficult for the gallbladder to work or convert that. They will form into what you call gallstones. You understand now? Okay, they will form into gallstones. Those that you eat from the butter, from meat products, they will form into gallstones. So, and the drugs, these drugs, what they do, they inhibit the work of the liver. They inhibit to release the hormone to form what you call the same cholesterol. They inhibit, and they now make the blood to thin, or they make the blood not to be clotting. They call them blood thinners. That's the reason all those people who are on stroke medications or BP medication, most of them, they are given thinners such as aspirin and other medications to make the blood light, because they know that what causes BP and other is the blood fat. Blood fat will do what? It's like the way in physics we learned. It says that if the volume of the pipe is big, the radius of the pipe is big, that volume is big. Yeah. Yes, the diameter, yes, is big. You discover that the water will be slowly in the, but if you reduce the pressure will increase. Huh? That's the reason if we were watering, if the diameter of the pipe was big, we just timafyanta ka pipe tikafyanta kuti manzi yashuke na pressure, and the patari comes out with pressure. That's what happens with BP. BP is because fat. So if in the blood arteries there is now blood fat, then what happens is that the radius or the diameter reduces. Then if the narrow is it has, I mean, if the passage has become narrowed, there will be high blood pressure caused by blood fat. Caused by blood fat. So then now, so these medicines that inhibit, they are not good. They are no good. They damage the liver and they damage the gallbladder. That's what they do, eventually. That's the reason we have a lot of problems. Those people who've been taking those, and they bring a lot of conditions. So how do we cleanse the gallbladder? How do you cleanse it? It's very simple. You day one, on day one, a person should not take any fat or lipids, food, or even protein. You can remove protein, fats, and lipids. You remove. So a person on day one, like today, you just eat a lot of fruits. Okay, a person is on fruits. Then on the morrow, so meaning you haven't stressed the what? The gallbladder. If you have eaten, you've picked the day, you haven't picked the day eating citrus food, you haven't stressed the gallbladder. Then on the morrow, you at 12 hours, so you continue with your diet on fruits, a lot of fruits. Then the following day, now at 12 hours, you take what you call 1 tablespoon of Epsom salt, 1 tablespoon of Epsom salt, and you take lemon. Take lemon. If you do not have lemon, you can use what you call apple cider vinegar. Apple cider vinegar. If you do not have apple cider vinegar, you can use lemon crystal. So you get Epsom. If it's lemon crystal, you see a teaspoon. So you put 1 tablespoon of Epsom salt into a cup of boiling water. That cup could be 250 ml. Then you drink. Then you put, if it's lemon, squeeze it. You should just take 2 tablespoons. 2 tablespoons of, don't use a metallic spoon. Citric food react with metal. Use a plastic one. So you drink. If it's lemon crystal, you use half teaspoon in water or a teaspoon of lemon crystal in the same 250 ml you drink. It's warm. Then upon part 12,
If it's apple cider.
Okay, if it's apple cider, use a tablespoon. Use a tablespoon, 2 tablespoons or a tablespoon of apple cider. And then you can dilute it in water. You can put it 150 ml of water. You put there. Because apple cider, others, it burns them. So you can put 2 tablespoons of apple cider in 200 ml of water to dilute so that you drink. Okay. Then apple cider, warm or room temperature. Then what happens now? At 17, part 12, mama. Yes, same day. At 17, you repeat. 17 or 18, you repeat the same that you have done. Then pogona, when you're about to sleep, you get olive oil. You take half cup of olive oil. That is 200 ml of olive oil. You drink. Yega, pogona. Then after you've drunk that, then you can take, if you had lemon, you take lemon. The dosage is the same. Or if you have lemon crystal, you take lemon crystal. You don't put Epsom in the night. Or if apple cider, you take then you sleep. You sleep on the supine position. Supine position is myangana kumalata. You sleep up, facing up. You don't sleep on the prone position. You don't sleep facing down. You sleep up like this, facing malata, facing the roof. In the morning, you wake up. Then you repeat, you take Epsom and the lemon or apple cider, okay, in the morning. Then 2 hours later, then again you take the same. That is the third day, guy. Yes. Third day. As in the morning, you take the same with lemon crystal and Epsom. In the morning. 2 hours later, food again, you repeat. Then after that, then you wait. You are just waiting for the result. The results, you go to the toilet. If you have a good toilet, or if you want to, you can poop down so that you see the gallstones. Or if you have a flushable toilet, you flush, you'll be seeing to my yellowish stones. Yellowish stones. You see them, okay. Or if you want others, they capture for me so that I see. Are they the ones? You even if you machitira muchichani chibafa or chikaja kakopo mzambera tu fulani tuminyara tuchoka yo tumankara tu fulu agaso. Yes, yellow or greenish. Yes, they are stones. Yes, they are solid. 200 mils. Yes. You see how simple it is. Very simple. Eh?
Sorry,
You would have
so
agile.
when you are going to sleep, once you drink the olive oil, you said you drink the Epsom and what? After drinking the half cup of olive oil, which
After
one are
drinking
you?
the half cup of olive oil, you only take lemon, or if you do not have lemon, you have apple cider vinegar, or if you don't have apple cider vinegar, you take what? Lemon crystal. Okay, you don't
Not
put
the
Epsom.
Epsom.
No,
Okay.
don't put Epsom.
All right.
The reason to why Epsom is there in this is because Epsom, there's magnesium, Epsom is magnesium sulfate. It will not cause pain. And it allows the what you call this process to happen. Because what happens that once this vachoka, when my friend asked me, saying, so how is this going to happen? You are going to poop. You are going to poop gallstones. There's the edge. The edge. Yes, yes. In the case of your friend, your one says we did the wet sheet back. Okay. So what we did, him, others, they even start diarrhea in the second day. First day of fasting on fruits, they are on fruits. Second day, once they take just apple cider or lemon crystal and Epsom, they begin now to do what? Okay? Swasia, they will continue. Others, they do like that. Swasia. Then my time when you remove the gallstones is the time when you take olive. Olive is the one that is going to now remove them, cause the oil. Remember, the gallstone works on the oil, so it will go there, and if there are gallstones there, they will come out from all of them. They will come out from the gallbladder. Yes. Going to collect. Using what? Hey, you not know. You miss your opportunity of seeing.
So the idea is
others, they have issues to do with what do you call the symptoms will act as if you have gases. Most of people that complain mumana, fever, as if the air, yes, they as if they have gases. Okay, and other fever conditions. So there are a lot of conditions that you receive from, and eventually it can. Others they complain gases, gastric ulcers. They are similar. The symptoms to do with the gastritis. They are similar. The symptoms of the people who have gallstones or stomach upset. You feel as if the stomach is up, but can't see. So others, the liver will begin to malfunction, because once the gallbladder is cleansed, there's a patient that we have. She has what you call gallbladder cancer of the gallbladder. They're doing chemo on her. Okay, so there are people who are prone to have such conditions. So it will
Manje,
prevent. Yes.
so now the day one you're eating fruits, Manje, day 2 and 3, as you are drinking the Epsom solution,
Yes,
what are you eating
you are eating fruits and vegetables now.
on day 2 and 3?
Yes, ungadya nsima ukudya. Kairi, what we're avoiding here is that we're avoiding lipids and fats and protein. You understand? So you need to identify foods that do not have these.
Okay.
Into what? Carbohydrates. Yes, carbohydrates. But what we're avoiding is lipids and fats.
Like when you mentioned the case of vegetables,
So
what about the cooking oil?
You're not putting cooking oil.
Yeah.
You're not putting.
That's what I wanted people to say.
We are removing lipids. Lipid ni mafuta, fats, oils. You are not done. That's the reason in some cases in combat vegetables, there are vegetables that have protein. So you remove. Hi. When I'm going to shaba. Yes, fruits, yes. So that you have a smooth cleansing, even the cleansing. That will be even a beneficial fasting, because the purpose of fasting is for concentration and the cleansing. Because as when we were learning, I remember when we were learning fasting, for instance, you are fasting, then because in the time of fasting, it's discovered that the food that we're eating, so the body will stop. It will stop since today you haven't eaten. So what the body does is that it will use the energy that you are eating as your energy. Now you are not fast, you are not eating. So it will get now the reserved food to convert it into energy. So imagine now the reserved food, it was bad food. It will reserve it into energy. And the food that you've been storing, it is not good food. It will be work done equals to 0. You understand? To be work done. But the benefits will be that it will remove all the impurities, that bad food that was stored in the adipose, into the liver and into your skin, layers of the skin, adipose, layers of the skin, into all those, it will be removed. Okay. Others, they will pimple, okay, or they will cleanse. And they will look smooth after that, after cleansing. Then it will deposit it in the colon, then they poo the dirt. So after that, you have to refill. Most of the people after fasting, they don't know how to fast. Ija time was a fasting, yeah, bazadia. And in the night, the body is not ready to receive food. But that's the time we break fast. Understand? We break fast in the night. Okay. Because the ideal way on how to break a fast is you eat a lot of vegetables or soup. You prepare soup or your vegetable so that it collects, because the soup will act as fiber of the food, of the dirt that was collected in the skin and the liver, so that soup, the fiber, will act as fiber to cleanse them from the colon, so that you poo the dirty that was collected from a body. Or you eat fruits. That's how you break a fast. Others, I hear others, they do with porridge. Porridge will not help you. It is only fruits or vegetables on how you break the fast.
I know we have run out of time, but you touched on a very important component when you are trying to explain this bonus that you have given us to say. You consider the people with the BP and the drugs they are taking, that they just help to thin the blood so that it passes and then lowers the reading. Actually, it is just putting us on the reading of the numbers, not necessarily that it literally helps. Now, to substitute those drugs completely and do something that the body naturally requires, what can one do?
Okay.
Yeah, so that the blood is not having a lot of fat, neither is it causing him pain. Yeah. So,
Okay, so to facilitate answering the question is like this. So what causes hypertension? There are different factors. What causes hypertension? So there's what you call minerals. There's sodium and potassium. These two minerals. What balances potassium? I mean, what balances sodium? It is potassium. The salt that we eat, it has only sodium and chlorine, the salt that we eat, the table salt that we eat. And they came with an apology. They added iodine. That is what is called iodated salt, because oftentimes during that time people used to suffer goiter. Yes, goiter. Okay, so they said, okay, those who are producing salt, you should be putting iodine, because you are removing iodine from salt. So there are three in the salt. So therefore, a lot of people, they suffer from potassium deficiency. Potassium deficiency. They have excess sodium. So if excess sodium were to also cause hypertension, it will cause hypertension. So they have to know that. So that's the reason people today, they have gone to buying black salt. There's a salt called black salt, or sotiachi para, or they buy Himalayan salt. So they have to correct that, to be buying natural salt, because Himalayan salt has potassium. Soti natural para, it also has potassium. Black salt, people, others who have hypertension, they've reported to me saying black salt, they didn't balance it well. It is high in the sodium, so therefore black salt is not okay. But the USDA and FDA, they've approved black salt. They haven't yet approved Himalayan salt. So the one that they have approved is black salt. But black salt, you cannot compare black salt versus Himalayan salt. Himalayan salt is better than black salt. Then the other one is the other thing that you have to know now is this one. Is I've talked on potassium. Okay, so potassium foods, dandelion, to why it works on hypertension is because it is high in potassium, dandelion. Okay. Then there's another one now for blood fat. Blood fat. So if the cause is blood fat, what do? They go in weeping willow. Weeping willow bark, it works as a blood thinner. It is a natural blood thinner, but it will not cause blood not to dry. It will not cause blood not to stop clotting. It can clot blood, which is a weeping willow. You know it, huh? Okay. Weeping willow. Okay, you can Google it. It's there. Weeping willow. The bark of weeping willow is very good. Others they use what you call green tea. You know, green tea is very good as well for hypertension. Others they use hibiscus. Hibiscus. So hibiscus plus green tea to work as very effective. Okay. Or use dandelion. I know of a certain woman, the favorite is dandelion for whichever, if the heart is enlarging, she uses dandelion roots. Who is that? The one for vacation. Who was those? That woman, her sister Nan? Sister Wamnyima. Okay. Sister Wamnyima. Her favorite is dandelion on hypertension and cardiomegaly. Okay. So what other thing for BP? We use garlic. Garlic is very good. Garlic and the onion. Onion is the most underrated Onion is very effective on the issues to do with enlargement of the heart and BP. Onion and garlic. These are natural blood thinners. If you want, you can put also lemon, because lemon will help also to remove, to help with blood fat. So lemon, garlic, and onion can work, but not the garlic, not the powdered garlic. Powdered garlic doesn't work, or powdered onion. It is the actual onion. You can boil and drink the water, or you can get the garlic, boil and drink, or chew the garlic. Those people who cannot tolerate the garlic, they can just put, others they take honey, they put on honey, smash it, and once they grate it, put it on there and take a syrup. That will work. Okay, basic. Then the herbal, exotic herbs that they use is they use what you call boogerweed. Sebi was using boogerweed. Boogerweed is not in Zambia, so we can't waste time to look for boogerweed. They use also hawthorn. Hawthorn is not in Zambia. You will just be looking for hawthorn. You waste your money on hawthorn. Okay. Motherwort. Motherwort is not in Zambia. It's not exotic. I mean, it's not local, indigenous. It is exotic. So we have to use Ivamene Ventinavo. Weeping willow, we use also mpundu, bark yampundu. It also works for people. Okay. So just use things that we have. And yes, the bark, you make powder, a teaspoon. It's a dosage twice a day in infused water. Others you can put, if it's you capsulate them, meaning it will be 3 capsules. 3 capsules, that is 3 capsules, 5, so it will be 2 capsules, 500 milligrams twice a day. If you capsulate them. Yes, yes. And they started selling garlic now in the pharmacy. They started selling turmeric capsules and the garlic capsules. And even moringa capsules. I don't know if it's in. Yes, that's what happened. Yes.
So what I was saying about garlic, the garlic, like my father has got blood pressure, but what he does, he doesn't use this garlic, the big ones. He uses those small ones, those small garlics.
No, there is what you call local and Chinese.
Yes.
Which are very white is Chinese.
Those big ones, they don't work.
Yes,
But
yes.
he only uses those smaller ones. So him what he does, when the blood pressure is high, just gets those smaller ones, 10 of them, and then he drinks them as if they're capsules. Then he goes to sleep. After that, he sleeps there, and then starts going to the low. Immediately he's just going to the low, the blood pressure does what? Goes down.
Okay,
So even for those who are unable to chew them, they can just swallow them.
No, it will not really work. It will not really work. Because what we know is when you learn on the cell is that the medicine is found in the chlorophyll, and the sap is found after the cell wall. So the garlic, if you swallow something, or for instance, swallow seed or garlic, you're going to poop it. You understand? So the lysine, which is found in garlic, which works as medicine, it has to be reached inside. So it has to be grated. So you can tell him so that it will be working effectively. He has to be, yes. So you have to help him do that. Yes, to crush them. Because what they did is this, like these ones, is it epidemiologists? They took the same garlic to test. So then Dr. Hijdi is the one that was reporting this. They took the garlic. Yeah, they took the garlic. Then it was powdered garlic. Powdered garlic doesn't work. And actually, sometimes again they use this foolish garlic, the Chinese garlic. Chinese garlic, even when you grow it, it's difficult for it to grow here. But when you grow this garlic, we tried to grow this same garlic. Once you grow it, what you call organically, it is very strong. It becomes 10 times. You can't manage to eat kamozi. You can't. Okay. So the same garlic, fresh garlic is very effective. Powdered garlic, it will just work for culinary, for food purposes, or thickening soup, but do not work. Use fresh garlic. Okay, thank you.
All right, thank you so very much. This is where our morning session ends, and I'm sure we'll continue the week after next. And we thank God for the lesson. As we close, Elder Tembo, you are going to close for us in prayer, and remember to pray for the food also. So let us kneel down in so far as possible as Elder Tembo McBolan closes for us in prayer.
Our gracious and loving Father who is in heaven, once more we approach your throne of mercy. Father, to thank you for this special, timely health lesson that has come from your throne of mercy, flowing unto us. Loving Father, we appreciate the truth. Help us, Father, that we live according to the light that has been revealed unto us. We thank Father the brother responsible for the channel through which you have given us this truth. Everlasting Father, we have come to the close of the first half of our lesson. We pray, Father, that you be with us during this break time, and also, Father, that you may bless the food that is prepared before us, that the food may give us physical as well as spiritual strength. It is in Jesus' name that we pray with thanksgiving in our hearts. Amen. Amen.
Thank you so very much. This is where our morning session ends. Let's meet at 14:30 hours for the Bible study. Yeah. Thank you so much. Brother Sambamo, it's been a pleasure having you around. Thank you for your resilience. Others have dropped off. Sister Chimuka as well, thank you. So let's meet at 14:30 again as Brother Bernard takes us in the afternoon. Bye-bye for now.